Namashivaya. Good afternoon to all of you who have joined from India, and a warm good morning to Dr. Suneesh, who has joined us from London. We are continuing with the alumni student interactions. Today we have a session on career guidance conducted by the Amrita Alumni Association Kochi chapter. For this session, we have a very strong alumni, a 2011 batch alumni from Amrita Medical College, Dr. Suneesh. First of all, I'll go through, and first of all, I'll welcome all the dignitaries who have joined us. I welcome Dr. Prem Nair, sir, a director and provost of the Institute of Medical Sciences. Welcome, sir. I also welcome Dr. Girish Kumar, sir, Principal, Amrita School of Medicine, to this event. Welcome, sir. I welcome Dr. P.G. Nair, madam, Emeritus Professor, Pharmacology, Coordinator of Nodal Office for Statutory Inspections, and the Chief Coordinator for the Campus Alumni Association of our campus. Welcome, ma'am. I also welcome Princy madam and other dignitaries who have joined us. We will start off the session with a prayer. To start off the proceedings, I welcome Dr. Prem Nair, sir, for the presidential address.
Om Amateshwariye Namaha. Distinguished chief guest, faculty members, and my dear students, it is my great pleasure to welcome all of you to this insightful session on career guidance. I would like to express my heartfelt gratitude to Dr. Suneesh Noushad, our esteemed chief guest, who's for being with us today. Choosing a career path is one of the most major decisions anyone has to take, and it shapes our entire life and aspirations. Resisting all hindrances and making informed choices can be one of the most challenging events in our lives. Today, as we come together to share experiences, insight, and wisdom, let us reflect on the transformative power of education. Our most beloved Amma says, education with spiritual values transforms youth into highly capable and intelligent force of goodness, compassion, and service. As we proceed with our event today, I invite everyone to actively engage, ask questions, and absorb the wisdom shared today. Remember that everyone has a unique career, and this session is a stepping stone towards understanding of your future goals and bring about a brighter future. I would like to appreciate all the efforts made by the Amrita Alumni Association for organizing this session. Their commitment to supporting our students' growth is very commendable. Once again, my warmest welcome to all of you. Om Amateshwariye Namaha.
Sure, sir. Thanks a lot, sir. We are really honored by your presence, and thanks for sharing those insightful words, sir. Thanks a lot, sir.
Thank you.
Sir. Now I'll go on to welcome Dr. Suneesh Noushad, who is the resource person for the day. Dr. Suneesh, as we told, hi Suneesh. Dr. Suneesh is a 2011 alumni, and he is currently working as a junior clinical fellow in medicine at Ealing Hospital, London. Our students during our various interactions have requested for alumni from our institution who are currently working or studying abroad to kind of interact with them and give them guidance. And thanks, Sunish, for taking time and effort amidst your busy clinical rotations. Because when I called you last, you were just finishing your night shifts, and during your meager time, you are trying to help us out. Thanks a lot, and welcome. The floor is yours, Sunish. And at the end of the session, we will open it for questions also. Sunish, please.
Okay. Okay. So hi, I'm Dr. Suneesh Noushad, currently working as a clinical fellow in acute medical unit in Ealing Hospital in London. So I was part of the 2011 MBBS batch in Amrita. Uh, so yeah, that's the place where I gained all my wisdom and knowledge, and 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 grateful for everyone, especially my teachers and Lord and Amma for helping me do what I'm doing now. I'm extremely grateful for what happened in my life after passing out from Amrita, and also getting uh, getting the whatever the what I need. So yeah, uh, so I'm giving a short session on your on how to start your career in the UK as a junior doctor. So yeah, so the first question, can you hear me now?
Yes, Sunish, you can.
Okay. So the first question, which whenever we are choosing a country to work or study, the first golden question which we ask, which everyone asks, is okay. Sorry, just why, why are you choosing this country? So why UK? So yes, so yeah, I'll give you an answer in the next few slides. So why you're choosing the UK? Well, when you are, I mean, UK, being one of the, being one of the most developed countries all over the world with the advanced medical care and advanced living standards. Yes, UK is one of the most attractive options for medical graduates from all over the world. So, so whenever we think about, being a doctor, it's what people expect from us is like work 24 into 7, serving the community, serving the patients and serving everyone around you. But the perspectives in this country is a bit different. uh, so British people give a lot of value to the work life balance. uh, I mean, as we all seen, we work, we have heard about the 24-hour shifts. So back in India, where we work for 24 hours, maybe probably more than 24 hours, serving the patients. So, but in the UK, it's a system is a bit different. We are not allowed to work for more than 12 hours. So there is a European time directive in which, once you are fit, I mean, the maximum continuous shift and is supposed to be only 12 hours. I mean, you are not allowed to work for that, because for people here think that a doctor who's tired is potentially dangerous. Yeah, but I wouldn't completely agree to that, because but that's what the British people think. And you have a compulsory and the second thing is, like, you have a compulsory annual leave of 27 days a year, excluding the bank holidays and the study holidays and the weekends. So, if you're entitled to work in NHS, you should take your annual leaves off. I mean, you can't just work on your annual leaves or your bank. Yeah, that's how the system is designed in this country. And you have study leaves. So it's it's on an average it's 10 days. But depends on depending on the department you're working. Suppose I'm working in medicine, I get 10 days or study leave. I'm entitled to 10 days study leave. But before this current job, I was working in oncology as a junior doctor. There I used to get 15 days off. And also the number of study leaves increases when you are in training. So when you are in training, obviously you need time to fill out the portfolios, to do the audits. There are many assignments which you have to complete in order to get to pass the assessments. So if you are in training, you get additional time off. So what I could understand is that from my work is that the doctors in training, mainly the internal medicine trainees, they get there is something called STT, where you get time to study. Basically time to study, and every month you get 1 day extra off. You can ask with the rota coordinator, and they'll just assign you a day. So if you are in training, so suppose you have 27 days of annual leave, 10 days of study leave, and additionally you get a 12 days off when you are in training. So it's your holidays count just adds by 12 when you're in training, which is actually a good thing. So that you can focus on your portfolio and your exams and everything. And so if you're working in NHS, so NHS is basically the public healthcare system in the UK. Once you are qualified to work in the UK, you start working in NHS. It's a national healthcare. So you are entitled to blue light card. So blue light card is basically like, if you're working in NHS, you have a blue light card and you get discounts wherever you go. So some shops give you like 10 to 20% discounts. Yeah, and yeah, I use that to save some money. Yeah, in the UK there is a free healthcare. In the NHS is entitled to the fact that the citizens of the country should get a free healthcare. Unlike US or any other country where you have to pay for your insurance, it's not the case here. So whatever treatment you need or anything, so if you go to NHS, you can get the treatment for free, provided that you are a citizen of this country or you have a right to live in this country. So in order to get free healthcare, there is an NHS surcharge. Surcharge is basically a small amount which is being taken from your every month salary, and you get your salary after deducting that. And well, that's a very small amount, and that's how this country runs. As I told before, the work-life balance. It's people in this country consider this as a very big thing. And so it's very important. It's very important here. And there is also a study budget. So if you want to attend any courses or do any training which needs suppose for example, I had completed advanced life support course from the Resuscitation Council UK. It costed the cost of the course is £400. That's like approximately 40 to 42,000 Indian rupees. And so once I completed the course, I just sent my bill to my to the hospital, and they just reimburse the whole amount which I spent on the course. So yes, so they give you time off work, they give you money to do courses as well when you're working in the NHS. So you are entitled to have a sick leave, maternity, and also paternity leave as well. So obviously it's there in every country. And you have an option to do part-time trade. So suppose you have your family commitments, you have children, or I mean, there is a reason why, you need to be, you have to take time off from work when you are in training. So there is an option to do part-time training. So, I mean, back in India, or I mean, in US as well, there is no option to do a part-time training because, well, the system is designed like that. Here, if you want to do time off, then you can have it. So I've seen many of my colleagues having, being in a 80% training. So basically, they work from Monday to Thursday, and they got the time off from Friday, Saturday, and Sunday. And but the problem with this training is that you get you need to spend additional time as well, probably one more year. So if it's a 3-year training, you have to do a 4-year training. But yeah, that is an option to do like that. And the next thing is like, what we are used to back home is that, when we are doing a training, so suppose we are enrolled into an MD general medicine course, so we had to pay the hospital to do the training. But in this country, it's the other way around. We get paid to do the training. So which is actually, I mean, being in training does not, I mean, affect any of your finances. In fact, it just boosts up your finances. And so once you have if you have experience of working in NHS, it gives you a chance to work in Australia, New Zealand, certain provinces in Canada, and also in the Middle East. So I've seen many of my colleagues here, pretty, most of them are local graduates or graduate in the UK. So once they finish their foundation year is basically the internship. So in the internship, they move to Australia and New Zealand to work there, because they think that it's because of the weather, because Australia and New Zealand have sort of a bit more warmer weather compared to the UK. So they move there, work for some time, and also the pay. The pay is slightly higher in this country with the less taxes, and they work there for 1 or 2 years. And eventually, they come back to the UK because these two countries don't. I mean, they want their people to get into training program rather than foreign medical graduates. So they eventually come back, but after earning some money. And also, certain provinces in Canada, they accept the UK. Once you have finished your UK training program, they accept the UK trained doctors. So I've seen many of my colleagues, especially the GPs and also the psychiatrists, they move to the underserved provinces in the Canada. So underserved provinces are the places where the less number of people live, and it needs more boost up. And the most attractive one is the Middle East. So once you finish your training in the UK, so if you apply for a job, the Middle East accept every doctors from every country. So once you finish your training in the UK, you are considered as a tier 1 specialist. So basically, you are the one on the top. And yeah, and that's what many of the Indian doctors who are trained in the UK do. They move to Middle East, and the pay is quite lucrative as well in the Middle East. If you, they just want to take out they just want to have Indian doctors. I'm sorry, the British doctors working there. Yeah. So what I personally love living, having being in the UK is traveling. So after moving to the UK, we have traveled around 4 to 5 countries inside the Europe. And yeah, so I would say, this is the most attractive part of living in the UK. I'm someone who believes that, you should have maximum number of stamps in your passport. So yeah, so if you like traveling, if you want to see as many countries as possible, there is no other option than the UK because it's in the center of the world. So look, I'm living in London. Paris is only 1 hour away from me. It just takes me a bus to get to Paris. And Berlin is just 1.5 hours away from me. And yeah, Iceland is 2 hours away. If you want to see the to the northern lights, and there's no better option than that. These are the few pictures of my travel. So this is when we traveled to the Lake Como in Italy, and I would say that's one of the most beautiful places in the world. And this is in the Montenegro. This is Kotor. If you go into Instagram or any other page, this place is quite famous. If you love traveling, then there is no other better option than that. And this is a picture in Turkey. So yeah, coming back to how a junior doctor can move to the UK. So what I did was that I gave PLAB exam. So PLAB exam has been recently been changed. I would say that's just renamed into UKMLA. That is the United Kingdom Medical Licensing Exam, and PLAB is Professional Linguistic Assessment Board. So what is a PLAB exam? So it is a two-part licensing exam which assesses your skills and knowledge of the international graduates to practice in the UK. So yeah, so once we finish the foundation program, also known as internship, it gives you the it makes you eligible to give the PLAB exam. And like many people think, it's not a degree. It's just it's a licensing exam which gives you the right to work in the UK as a junior doctor. So yeah, that's how it is. So moving on, what can we do? Firstly, in order to give the PLAB exam, you have to prove your English proficiency test before. I mean, once you have cleared your English proficiency test, that's either IELTS or OET. You have to get a band of 7 in each module, and these are the 4 modules, and you had to have an overall of 7.4. I gave IELTS because when I was giving during that time, OET wasn't introduced for the medical for the doctors or nurses, so I gave IELTS. And you just have to get a score of 7 and 7.5 in each module. Since most of us have quite a good proficiency in English, that should just be a cakewalk. And also there is OET. It's a bit more expensive exam, but but that's also acceptable. IELTS costs you around 20,000 rupees back in 2019. I don't know what's the current rate now. And OET, I think it's 32,000 rupees or around, that sort of range. And so PLAB. So it's an exam which gives you which tests your ability. I mean, it tests your clinical knowledge in the care of patients. And so suppose you're when you're working as a foundation doctor, if there is a patient patient coming in front of you who's quite sick, and it tests your ability, how you manage the patient, and it doesn't test your memory skills. So I gave PLAB 1 back in 2019 March. So what I've noted is that you don't actually get questions regarding the most theoretical questions regarding the branch of any nerve or any nerve which you haven't actually heard of, or any question from the brain anatomy. It's just it's all clinical related. So it consists of 180 questions which you had to fill out in 180 minutes. So you had to complete one question a minute, which is actually quite reasonable. Some questions are quite long. I still remember, some questions are quite long. You just have to read through the question really carefully. Suppose sometimes, the values might be there. You just have to analyze that. But that should all happen in the span of 1 minute. But some questions are quite short, so it should balance out eventually. So yeah, as I told before, it usually covers the common conditions seen by a senior house officer, also known as the interns, and also it's how and the management of those cases. So you don't get the rare cases. You just get the common cases. You tend to get maybe probably emergencies such as probably a sepsis or an MI more than a relatively rare condition which you have only read about in the textbooks. And you just have to cover your basics to pass the Platon exam. So the next. So where can you give your Plabon and who can take it? So Plabon happens 4 times a year. It happens in February. Sorry. March, August, and May. It happens in the UK and it happens in India as well. So I gave my exam in Chennai back in 2019, and but what I could understand recently is that the Plabon seats in India gets sold out really fast. So if you're planning to give a Plabon exam, keep your open mind. You should I recommend you to be ready to travel to any part of the world to give the PLAB exam. So yes, so I still remember, I mean, when my wife was applying for the PLAB exam, we were actually looking for seats, and I mean, when a seat comes up, when you click it, it just goes away. I mean, someone else takes it away. So getting a Plabon seat in India is a tough task recently. But if you are ready to travel anywhere over the world, then it should be okay. Yeah, so obviously you need to avoid countries which are quite unsafe while choosing the PLAB dates. And the basic thing is that, in order to give the PLAB exam, you should have passed your final year MBBS. So if you are a medical student, pass your final year. That's a major important thing for you guys. Oh, and yeah. And meanwhile, you can clear your English language test, either IELTS or OET, if you're planning to take PLAB1 during your internship. So the validity of OET or IELTS is 2 years. So if you are in final year, probably you can, if you have time away from the clinical, postings, what you can do best is, clear your OET so that, once you pass your final year, you can book your PLAB date as soon as possible. Because, getting a PLAB date isn't an easy affair. PLAB1. PLAB2. So PLAB2, that's the, it's the second part of, it's the last part of the, the PLAB pathway. So it assesses your, one second. Yeah, so PLAB2, it basically assesses your professional and clinical skills and knowledge and behavior. Suppose it's basically an OSCE exam. Suppose, for example, there is 8 minutes. There is 8 minutes to complete a station. So it's basically mostly it would be a practical a case which will be seeing as a junior, as an intern on a daily basis. For example, you you go I mean you it's a simulated exam as well. So once you go into the station, you see a a person sitting inside. You have to take the history. Outside the station, there will be a there will be a information given, a brief information given regarding what could be the scenario. And once you go in, you have to take history from the person. He would be a trained actor, and there will be examiners monitoring you via the camera. Or sometimes the examiners might be sitting there inside the room as well. So you have to take history from that particular that it's from the trained actor, do sufficient examination. Ask for the investigations. Also, still I remember when I got was a case of acute pancreatitis. Uh, so, so while taking the history, I could understand that he had abdominal pain, which was radiating to the back. Then I asked for the amylase. Then I did a brief clinical examination, examining his abdomen. Then I asked for the amylase, and I found the amylase, and I did the management. So, the management should be in like how you do as a junior doctor. If it's pancreas, you have to rehydrate him, give the pain medications, and make the referral to the specialty who needs to look after him. So it's you will be only seeing the things which you are seeing in your regular days. It's not something which is it's not Greek and Latin. But what it's a bit different is that you might there from our system is that there are ethical cases. So ethical cases like involving the problem colleagues, or yeah or issues which you see in the daily life. Still I remember. So out of the 16 scenarios I had, 5 to 6 stations were related to ethical cases. So it's good to have your clinical knowledges. It's good to have really strong clinical knowledge, but you should have good communication skills as well in order to be to pass the PLAB exam. So yes, so it's not just the clinical knowledge. You just need to have a good communication skills as well. Demonstrating the professional values and everything. So yes, as I told before, you are tested in data gathering. You take a clinical history, do a physical examination, then you formulate a management skills. Making a diagnosis and doing sufficient enough management, and yes, and also how you make establish a rapport with the patient as well in order to gain knowledge. That's what I call your communication skills. The communication skills are quite important in this country because it's like that. Because it's like that, and it's important to because it's very important in making a diagnosis. If you don't have a proper if you're not making a proper connection with the patient, it's not very easy. So yeah, in order to pass your PLAB exam, you should pass at least 10 out of your 16 stations, and the total score should be more than 10, and you should pass more than 10 stations, and the minimum cutoff score. So for every day there will be a minimum cutoff score. It varies every day. So if you are having a score more than 10, then you should be passing the exam. So unlike USMLE, the pass course doesn't matter. Even suppose you have got you passed only 10 out of 16 stations, or There's another person who have passed 16 out of 16 stations. There's no difference. You both are in the same boat. So yeah, the golden question. You passed your PLAB exam. You successfully passed your PLAB exam, everything in the first attempt. And what to do next? Enjoy, because you're achieved something really great. Celebrate. And the second one is get the GMC registration. You had to send off your formal certificates and yeah, and a few paperwork from the country of your origin regarding your medical practice to the General Medical Council, which is actually the body governing the medical practice in the UK, and get the GMC registration. And yeah, start job application. So many people have seen that they pass the PLAB exam, but it's equally important to make a strong job application. So for junior doctor jobs in the England and Wales, it's you need to apply to there is a website called Track Jobs. For the jobs in Scotland, it's the same website, and also Northern Ireland, it's a different website. So I've applied for jobs in England and Wales only, but it's important to apply for jobs in Scotland as well, or Northern Ireland. So you can apply for jobs, the non-training jobs. So, but you can also apply for the training jobs as well. There is a specific thing called a standalone foundation program. So for doctors who are trained abroad, it's a 1 year training program where you are placed across various specialties in order to land your foot in the NHS. So approximately there are 240 posts across the UK. So it's as I told before, it's a training program, and obviously you'll have the time off more than a doctor who's in the training program, because you have portfolios and your assessments to be completed. So you apply for standalone foundation year via a different website named Oriel, and it opens the application window opens every January every year, and closes on late January. The dates might change, but it's important to keep an eye on the website to know when they are opening the dates in order to apply for it. So yeah, I haven't applied for this post, because when I applied for the jobs in the England and Wales, I got it straight away. So I haven't applied for it, but it's worth considering. So the golden question. So everyone who is moving to the UK wants to become a specialist at some point of time. So how to enter a UK training program? Well, it's a bit different from the other countries. So if you're going to New Zealand, Australia, or America, they when someone is applying for a training post, the local graduates or the people with the respective passports are given a bigger priority compared to the international graduates. But in the UK, it's a bit different. So everyone is considered equal. So you have if you are applying for some specialties are quite competitive, like in the UK, like hard and high demand, such as radiology or surgery or ENT. So when we are applying for a surgery training post in the UK, if your application is quite good, then they don't care whether you are an international graduate or a local graduate. If you're good, then they'll absorb you in. Unlike unlike other countries where certain international graduates are not allowed or are considered lower down the list on application for the training program. So it's a bit different from NEET. So if you're applying for a medicine, then it has a different pathway. If you're applying for surgery, then the pathway is a bit more different. It's not like NEET where you give a single exam and people are allocated according to the ranking. So how will you apply for the training program? So once you start working in the UK, you have to get the CREST form. It's actually a list of competencies which has to be signed off by a consultant. Who is supervising you, with whom who have you worked with, and you have to apply that via the website, and you have to upload your CREST form in the website, and the people will assess your CREST form, and they will give you, and you can go forward with the application. So the training applications, including the before mentioned standalone program, goes via the Oriel website. So the question, how much do you get paid? So roughly you get paid 44,000 pounds per year, which equals to 32,000 per month if you are in the on-call rota. If you are not in the on-call rota, your pay goes down slightly low, around like 2,900 pounds. Once you finish your training program and move on to the level of a registrar, then your salary increases to 4,000 to 4,500 pounds per month. Once you finished your whole training pathway, you get paid more than 5,000 per month. And also, always the incomes can be supplemented. There are ways to boost up your income. So what I do usually is when I go for for the trips, what I do is like a weekends, I take additional shifts on the weekend, also known as locums. So where you are, where there is, whenever there is a gap in the rota, the rota coordinator puts up the shifts in an application in an app where we can pick up the shifts. So once we are accepted in the shift, we can take that, and we get paid on an hourly basis. So on an average, you get paid 50 to 60 pounds per hour when you are working on a weekend, and the pay goes even up if you are working on an unsocial hours, such as if you're taking a night on the days you are not working, you get paid really well. So on an average, so if you get paid like 400 to 600 pounds for a single shift you are taking when you're working off your rota. So that's how I fund for my trips from the UK, which is actually a good thing because that system doesn't exist in our country. So if you then you can earn as well. So yeah, that's it. I know this information is not enough. There are lots of questions which are going through your mind. So yeah, you can always WhatsApp me or drop me an email. I mean, people can note down my number, and I'm always there. Hopefully this helps.
Yep. Thanks, Suneesh.
Any questions?
Yep. I'm sure. Thank you for taking us through your journey and also the tips for students. At least I believe some of them are considering UK as considering UK as a future option for them. So before opening the floor for questions, I have just two questions for you. One is like they're all into their second year now. So do you think is there anything they should start doing now? Like because once we interacted with another alumni from UK, she was kind of saying that probably take part in clinical audits and things like that. That would probably add on to their portfolio and things like that. So is there any advice?
Exactly.
Yeah.
Yeah, exactly. So, you know what, if you're starting a journey early, then it always adds up. So you can, so people can, you can take parts in the clinical audits. So, I mean, I haven't done an audit back in India. I started doing audits only after I came to the UK. So if you're participating in clinical audits, then, and you have an evidence for that, it definitely boosts up your CV. But the most important thing is passing the regular exams, because if you need to pass your PLABs, then your basics should be, I mean, you have to have strong basics.
All right. Right. Any questions from students, please?
If any of the students have any questions in mind which are popping up later, I can pass on my number. I can pass on my WhatsApp number or email. I can always help. I'm always ready. I'm always open to help students around.
Right. Thank you, Suneesh. And I request students to kind of notice contacts and get in touch with him if at all you need any help. Okay. Thank you, Dr. Suneesh.
Okay.
I'll move on to the vote of thanks. So I thank Dr. Prem Nair, sir, who has always been an constant support for all the alumni activities, including this one. Special thanks to Dr. Girish Kumar, sir, who was instrumental in arranging this session for us by contacting Suneesh. And the backbone of our the whole alumni is Dr. PG Nair, madam. Madam has always been an inspiration for us, and has always been a persistence force for perfection. So madam kind of pushes us to our limits always whenever she gives us a job. A special thanks to PG Nair, madam, and all other alumni staff members, including Smita and Abhirami, and a special thanks to the audiovisual team, including Srijit and team. So with that, we come to an end of the program. Special thanks to Suneesh again, and we will end the session with a national anthem. And so this national anthem again is having a significance because this is played on a violin by one of my batchmates, Dr. Siddharth Vishwanathan.